There is a nationwide scramble to get more doses of the coronavirus vaccine as new cases continue to rise. Nearly 20 million Americans have received at least one vaccine shot, but the vaccination rollout has been slow and some states are reporting shortages. The U.S. reported more than 186,000 new infections on Friday. At the same time, hospitalizations are starting to decline, down 9% from last week. There's also growing concern about a new, more contagious variant of the virus. It was first discovered in the UK and now has been detected in at least 22 states. CBS's Tom Hansen has the details.
Whether it's the long lines at the Tennessee Dragway turned supersized vaccination site or San Francisco's mayor yesterday at the opening of a site there.
I'm so excited.
The message is the same.
The vaccine is here. We're not getting the doses in the time that we need them to distribute them. So that means we're still in this pandemic.
In Indiana, like too many other places, shots are given out until they run out.
I wouldn't be able to sleep if I knew that we were wasting vaccine or disposing of something that is so precious right now.
Nearly 20 million shots have been given in the U.S. since vaccinations began in December, an average of 982,000 a day. But a combination of demand outpacing supply and too many cooks in the distribution kitchen has bogged down the launch of the nation's mass inoculation process. At the current rate, Dr. Anthony Fauci estimates herd immunity, when 70 to 80% of Americans are vaccinated, is not just around the corner.
Hopefully, that will be as we enter into the fall and end the summer.
Health officials are also having to balance care for COVID-stricken people and vaccination distribution. California's Office of Emergency Services released video Friday showing cold storage containers available for counties. They're available to store bodies.
12 of these in a box.
In Kentucky, the governor spoke Friday about the flags outside the state capitol commemorating more than 3,300 people who died in that state.
These are all children of God, loved by their family, needed by their community, deeply, deeply missed.
And the virus's variants are causing concern, now present in 22 states, including Michigan, where Dr. Jim Grant is the state chief medical officer for Blue Cross Blue Shield.
And that means if 1,000 people have COVID, that means with this variant, 1,500 people would get this variation of COVID.
Now, health officials are recommending more masks. Hard as it was to get people to wear one, some are saying double up and wear at least two. Tom Hansen, New York.
Joining us now is Dr. Craig Spencer. He is the Director of Global Health and Emergency Medicine at Columbia University Medical Center. Dr. Spencer, we're seeing serious issues with both vaccine supply and distribution. What parts of the rollout plan need the most improvement?
Well, the biggest improvement that we needed was something we got just a few days ago, which was the release of a national strategy. As has been pointed out, we've been vaccinating people for about a month now. We have 40 million doses that have been distributed, just 19 million that have actually been given. Thankfully, we have been increasing the rate that those vaccines are being put into people's arms in the past few days to around 900,000 to a million. But we're going to need to do more than that, a lot quicker, a lot faster, and a lot better if we're going to want to get this virus under control quicker and in a reasonable time frame. Thankfully, having a national strategy, focusing on having the federal government assist both financially as well as with logistics, is going to be much better than where we were at beforehand, leaving it to already overburdened and underfunded public health and local state departments.
You heard Dr. Anthony Fauci just now say that he expects herd immunity to arrive somewhere around the end of summer or the beginning of fall. I'm wondering, as we are looking at President Biden's plans to try and get 100 million Americans vaccinated in the next 100 days, will we see a change in the way that we're able to live our lives within this next 100-day mark? Or are we really waiting until summer and fall before life starts to return to normal?
That's a good question. Look, we're at a really bad part in this pandemic. I know that the numbers are looking better. We have decreasing hospitalizations, decreasing new cases, but we have increasing deaths, and our numbers are still extremely bad. what the next 100 days are going to be is still really, really difficult. Even if we get 100 million Americans vaccinated in the next few months or the next 4 or 5 months, we're still going to have many people who are susceptible, and we're still going to have many people getting sick. We also know that there are new variants that you've already touched on that are concerning because they're increased in their ability to transmit. So that could throw, another wrench in the works. We need to have people continue, and I know people are tired, but over the next few months and potentially even longer, continue doing the things that we've known have worked and helped decrease transmission for so long. And it's the boring, simple, bread and butter public health things like wearing a mask whenever you're outside or in contact with others outside of your household, reducing time in indoor environments and washing your hands and just being safe, because we still have a lot of this pandemic in front of us, even if we're tired of it.
Dr. Spencer, this week, the Centers for Disease Control updated guidance for second vaccine doses. If a patient can't get the second shot in the recommended time frame, the CDC now says it's okay to wait up to 6 weeks. What impact, though, does that have on the effectiveness of the vaccine?
It's a good question. And to be clear, the preference is, of course, for people to get that second dose either 3 to 4 weeks after their first one, as has been studied for the Pfizer and the Moderna vaccines, respectively. We recognize that there are issues with the supply chain, there are logistical issues, and we know that it's unlikely there'll be a significant impact on the vaccine's protective ability if it's a few days or even a few weeks potentially later that you get that second dose. We know that there are a lot of challenges with getting people in long-term care facilities vaccinated, for example. We don't know exactly what the impact will be, but I think most people agree that it's likely to be small, if any. We just want to make sure that people understand that they should be getting it on the original dosing schedule that is preferred, and that people don't try to just get one dose and hope that that protects them. We don't have data to say that. We know that people need 2 doses, and if it's within a couple days or perhaps even a couple weeks for that second dose, it shouldn't have a significant impact on its protective ability.
Dr. Spencer, you have served on the front lines of global health crises, including Ebola, even surviving Ebola yourself, as I understand it.
Yeah.
I'm wondering, when you look back on how the United States dealt with the Ebola first coming into this country at a very limited amount, and then how we have handled the coronavirus pandemic, what are your takeaways? Why has this one gone so wrong?
Because we got rid of all of the learning that we so painfully learned during the Ebola crisis. After Ebola, the U.S. government put in place at the White House positions who were responsible for coordinating across the federal government, for making sure the federal government was involved in responding to emerging infectious disease threats, making sure biopreparedness was always at the table. And what we saw over the past year was, one, a lot of those positions had been ended. There was not really a strong federal presence in preparedness and in response. It was left to the states. And quite frankly, we had dropped the ball on preparedness itself. We have for a long time thought that our healthcare system, and here in the U.S., we were better prepared and we were better able to respond to things like novel coronaviruses or other infectious disease threats. But I think what we're finding is that with a lack of good, strong public health, with a lack of good, strong primary health care, and such inequities within our system, both with health care and without, and we have been vulnerable the whole time. And I think coronavirus showed us that. I'm glad to see there's renewed vigor and renewed commitment from the new administration for global health preparedness and biosecurity. We're going to need funding, not just for the next few years, but for a long time in the future if we want to be protected.
You sound a bit frustrated by
Sure.
By how this pandemic has played out, and you mentioned inequities just now. The Biden administration has made getting coronavirus vaccines out to communities that don't have adequate health care, that are traditionally underrepresented in positions of power, to make sure that those communities in the United States receive the vaccine. But we're also learning more about global inequities when it comes to the vaccine. I'm wondering if you can tell us, given your role as a global health expert, how much it affects not only the rest of the world, but also our country if we are not working to try and provide vaccines to combat this pandemic.
I'm smiling because I've done hundreds of interviews in the past year, and you are only the second person to ask me a question about what's happening outside of the United States. You're right. An infectious disease threat anywhere. Thank you. An infectious disease threat anywhere is a threat everywhere, and we will not be safe, regardless of how many vaccines we have or how we respond to this, until the world itself is safe from coronavirus or from many other likely emerging pathogens that will come to our shores in the next few years. Look, just in the past 15, 16 years, we've had 5 public health emergencies of international concern. I guarantee you that at some point in the next few years, next 5 or 10 years, we will have one, if not many more. We need to be engaged globally if we want to be protected domestically and locally. That has not been our focus. There is now a focus within this administration to re-engage, to build up global health leadership, to re-engage with the World Health Organization, and to join COVAX, which is a global community trying to get vaccines for places that, quite frankly, don't have the same financial means to advocate for, don't have the same connections as many in the United States to get these vaccines for their frontline providers. Look, a provider in Burundi taking care of patients deserves a vaccine just as much as a provider here in New York City. We need to prioritize getting this to them. And I think it is our global responsibility and a moral obligation.
And certainly one of the takeaways that we learned from this pandemic, if we care to learn our lessons, is that that viruses and outbreaks like this aren't contained in our global society. All right, Dr. Craig Spencer, thank you for all the work you do, and thank you for coming on and talking to me today.
Thank you.